Public health is the biggest challenge we face right now and possibly the most exciting opportunity.
We need to learn how to take care of populations. I want the UC San Diego health system to be a learning laboratory about how you do better health care. I think we can do things here that no one else can do.
The UC San Diego community and the campus has no boundaries, no borders. We can walk across the street and in 5 minutes be sitting with faculty in engineering. We can walk not too far away and be at the hospital. So what it allows us to do is to really approach problems with diverse perspectives.
Now I'm using geographical methods to map where infections are in real time to predict the course of epidemics.
We have done a lot of research to understand what causes different kinds of cancers. There's so much potential that can be made to truly enhance public health through prevention.
Now we have the ability to track and to follow using mobile phones and how people text to address cognitive disorders and mood problems.
The School of Engineering here helping us put together a wireless way of being able to measure a child's brain function.
We're working with veterans which have PTSD.
We're trying to change the behavior of the physicians. The goal is to incorporate an assessment of physical activity as a vital sign at every visit and then prescribe physical activity.
I work with people on how we can create a world in which older people are able to walk and be cognitively intact enough to do the things that you need to do every day.
UC San Diego is the right place right now for public health, in part because students here are taught to be difference makers.
One of the really important foundational principles of public health is not just that we're interested in promoting population health, but they're also interested in doing it in a way to promote health equity and to minimize existing health disparities.
A 40-year-old man in the bottom 1% of the income distribution in the United States can expect to die 15 years sooner than a 40-year-old man in the top 1%. The central challenge of public health is to reduce that disparity.
For me, UC San Diego is a disruptor for a very personal reason. My husband was dying from a superbug infection. We proposed an outside-of-the-box experimental treatment that was 100 years old, and this place made it happen.
We are doing machine learning and data science with engineers. We are working to understand income inequality and economic opportunity for women and what that means for health.
We are going through a time period where the amount of data that we have is increasing, and that creates a big opportunity because we have all this information that will help us understand really what's going on out there in the world, and that's how we'll know how to improve our lives and improve our health.
Very excited to be working in public health here at UC San Diego.
We're an engine primed and ready to go to solve a lot of the public health problems.
We have the energy and the momentum and the brains here at UC San Diego to address problems that are not just problems here locally, but are problems around the world.
In order to do something completely novel like this, we need philanthropic support from the outside. We need our community and our friends and people who think we can make a difference to invest in a new program. Without philanthropy, we could not do this.
We need to find new ways of achieving goals, and that creates disruption, and that's what UC San Diego is famous for.